This clinic in downtown Montreal serves roughly 12,000 patients in total, and it's unique. It's a GMF, meaning that it's a family clinic, but also serves as a center for victims of sexual assault. And people who work here say that Bill 2, that's the law that centers around medical reform, is pushing them over the edge. They say they're on the brink of closing.
Doctors are going to be making less money. We're also going to be likely losing some doctors due to Bill 2. And so that brings in less money, government funding for the GMF and for bonuses for prise en charge, all of these things all coming down. Therefore, we're looking at significant reductions in revenue.
There are 4 designated centers that offer aid to victims of sexual assault. And if her clinic closes, Vincent worries that many patients will be caught in limbo.
Waiting in a busy waiting room and then going on a stretcher with curtains as privacy. Instead, they get to come here. They get to see the counselor in a separate room right away, and then they get to see a familiar face from the first appointment all the way to the follow-ups. And so that gets taken away from them, and it's pretty devastating.
The bill is already causing irreparable damage. Vincent says her colleagues, and herself included, are getting job offers out of province. She says she's not ready to leave, but some have already decided. The clinic could announce its closure at the start of the new year.
If I'm gone and all of these other people are also gone, well, there's even less people to take care of them, right? If none of this was happening and I was leaving, I'd still be worried about passing them on to someone. And now it's looking like, well, it's going to be even slimmer pickings. Like, who else is going to be there?
The closure of this clinic could create a domino effect for victims who would have access to only one designated center for adults. If a part of the referral process is removed, it could create problems for those seeking justice.
We have to be able to use the proper tools, and we don't want to have anything that we do, should a victim decide that they want to press charges, be a problem, a logistical problem in a court setting.
When requesting a statement from Quebec's health ministry regarding this very clinic, it referred us to Santé Québec. Santé Québec then told us to contact the regional health agency, and CBC was also told to contact the Montreal Sexual Assault Center. The Centre West CIUS says it remains committed to evaluating and adapting its resources to meet the ever-growing needs of patients.